question that I always ask our new patients is, who's in charge of your care? And it's interesting that about half of the people say, well, doctor, you are. And I say to them, that really isn't the case, because it's important for you, the patient, to understand you are in charge. You are the captain. You are driving the bus, and you have to feel like you're in charge. Significant others in your life, whether it be a spouse or family members or friends, they are your first mates, and they are very important in this whole process. But we, the healthcare professionals, your doctors, the physical therapist, occupational therapists, nurses, social workers, and others, they are the individuals that will help you navigate this. And that's what we need to do. I also tell patients this: if you don't know where you're going, it's mighty hard to get there. And so a principle that I always stress to patients is this, is that we have to know what the right diagnosis is. And that's something that you have to feel comfortable about, to know what the diagnosis is, and then to understand about that disease process. Again, whether the pain is coming from rheumatoid arthritis or osteoarthritis, fibromyalgia, the Arthritis Foundation is a great source of information. On the website, there are different parts of the site that you can search to help you understand about these diseases. It's interesting, the word doctor has as its origin from French and Latin, it's teacher. And we need to teach you about these conditions. But you need to have resources where you can go back and help you to understand about this, because the better you, the captain, understands, the better all of us can help navigate what this process is, to how to best manage it. But when we think about chronic pain that persists, that is a great challenge. And I suspect that many of the individuals who are with us today watching this are having pain that's been there. And pain that's been there is different from acute pain, because it brings in different parts of our body, not only our body down here, but in our brain, of how we process that information. If we look at the definition of pain, pain is thought of as an unpleasant sensation. And that is true, it really is unpleasant. And when we have that pain coming into our brain, there's a part of our brain right here in the cortex that's where it brings pain to consciousness. And something that you need to know in terms of setting up your plan and understanding about the pain is that pain is also relayed to other areas, especially to the front part of our brain. And that's the part of our brain that adds emotions. And that's part of the definition, actually, of pain. It's the unpleasant sensation and our emotional response to it. And those emotions can be pretty challenging. And they're ones we have to think about, ones that we have to recognize, because when we think about when we're having this unpleasant sensation, it can be upsetting, it can be discouraging, it can be frustrating. It's an emotional response that we have that's appropriate, but it's not pleasant. And it makes us so that it's more difficult to deal with the issues that we're having associated with it. And so when we think about how we establish and determine what the best plan to this treatment approach is, we have to look at it understanding that there are many different tools that we have in our toolbox, many different things that we can help you with. But one thing that we, the healthcare professionals, always have to remember is that you are unique individuals. We're all different. And that we need you to participate most effectively. We need to understand exactly what the diagnosis is. We need to understand where the pain is coming from so that we can target our treatment most effectively to that. But included within all of this is the need that we have to have you be driving, to you feel like you're in control, but using the enormous resources of the Arthritis Foundation. I've worked with the Arthritis Foundation for a number of years, and one of the mission statements in the past was that the Arthritis Foundation is that we are your source of help and hope, and that is true. I mean, there's a great deal of help that's available online through different groups that you can interact with, but it also gives you that hope. Because when we're having this distressing symptom, when we have these problems, it's so impact so many aspects of our lives, our activities of daily living, our relationships with people around us, our ability to do our jobs and to do, activities that we need to do, that we like to do, but by focusing on this whole comprehensive pain management, we can work together to really get that outcome, to help control the disease process, to help you to understand what the best things to do, to individualize our treatments. And then really we can, as our programs state, we can break the pain chain.